Hi, Dr. Mattingly. Thank you so much for being a part of Connecting with Carnie. I am very excited to hear your perspective on tardive dyskinesia and the patient journey. From speaking with different TD patients and their care partners, I understand how important it is for patients to feel that their healthcare providers are on the same page. Can you tell us a little about yourself and your experience treating TD?
Certainly, Carnie. I've been a psychiatrist for over 30 years. I've been a principal investigator in over 400 clinical trials on ADHD, anxiety disorders, major depression, bipolar disorder, schizophrenia, and I've published many articles on these mental health conditions, as well as on TD and its impact. I see and treat patients with tardive dyskinesia, and I'm very passionate about helping them.
I'm excited to learn more. So how do you define or describe tardive dyskinesia?
Tardive dyskinesia, or TD, is a medication-induced neurological disorder characterized by persistent, uncontrollable movements. People who've been prescribed certain mental health medicines, particularly antipsychotics, to treat conditions like depression, bipolar disorder, and schizophrenia or schizoaffective disorder, can be at risk of developing TD. Certain prescription medications used to treat gastrointestinal disorders may also cause TD. It's important to note that TD can still show up after someone stops taking the medication that caused it.
Can TD go away, or does it get worse over time?
TD is a chronic condition that is unlikely to improve without treatment. So it's best to talk to a healthcare provider if you experience any uncontrollable movements. The good news is that treatment is available, and it's possible to achieve reduction in movements and even remission from TD.
Where do these movements happen on the body?
TD movements can occur anywhere: in the face, the torso, the limbs, the fingers, or the toes. Some examples are lip smacking, puckering, pursing, tongue darting, protrusion, jaw sawing, or chewing, excessive blinking, upper body rocking, jerking, thrusting, twisting of the hands, dancing fingers, gripping of your feet, and stretched out toes.
How many people have TD?
At least 800,000 people in the United States live with TD. Unfortunately, many of those people are undiagnosed. It's estimated that about 60% of people with TD remain undiagnosed.
So in your opinion, why are there so many people who are undiagnosed?
It's a great question. There's a number of factors why. Both patients and clinicians may not be fully aware of TD risks. And if someone has been on antipsychotics for a long time without issues, TD may not be a top of mind concern. Also, for some patients, regular monitoring isn't always done, so early signs of TD may go unnoticed. And those who do notice them sometimes feel the movements aren't severe enough to discuss with their clinician, or the movements aren't having enough of an impact.
What advice would you give to TD patients who are experiencing uncontrollable movements and starting to notice the ways that the movements are affecting them on a day-to-day basis?
I would tell anyone out there who's experiencing any type of uncontrollable movement to go see a healthcare provider. One of the things I tell my patients, Carnie, is share your history, be honest about the impact. Ask yourself, am I doing the same things I did before these movements started? What's changed? And I would remind that person that it's possible for uncontrollable movements to be managed and treated effectively. I would also encourage care partners and family to speak up if they see something in a loved one experiencing uncontrollable movements. Sometimes the movements, may start mild and the person may not notice them. That is where their care partner can step in and support them.
So let's say a patient walks into your office and has uncontrollable movements. How do you start to screen that patient for TD?
There are two important points when screening for and diagnosing TD. First, we screen everyone who is on or has ever been on an antipsychotic medication. Second, observation begins when you first get the patient from the waiting room. When you're getting them from the waiting room, it's looking at their movements, looking at how they behave, how they interact, what's going on with their hands, lips, tongues, or legs.
So earlier we talked about how some people think their movements aren't severe enough to tell their doctor. When should they start that conversation?
A patient should prioritize talking to their doctor or clinician anytime they notice something that is out of the ordinary. A care partner can also step in, let their loved one know about their movements, and schedule a doctor's appointment for them. In my opinion, it's always better to have a diagnosis.
How can a patient prepare to talk to their doctor or clinician about their uncontrollable movements? Is there any information they should bring to their appointment?
Definitely. If you see something abnormal, reach out to a doctor or your clinician so they can take a look. There are videos online where you can see what type of movement this is. The INGREZZA website has a lot of helpful resources. One is the Doctor Discussion Guide, which a patient can download, fill out, and bring to their next visit. A patient can keep track of their symptoms by recording their uncontrollable movements or recording the movements on a video. A patient can also bring a care partner or family or someone close to them if they are uncomfortable talking about their history.
Yes, and I have spoken with a few care partners, and they're incredibly powerful advocates for their loved ones who suffer with TD. I mean, I think they see what patients sometimes can't when it comes to the movements, and their impact. And based on your experience, though, would you agree that seeing patients with their care partners is beneficial?
Bringing a care partner to the appointment is a great idea. The care partner could share what the patient might be uncomfortable sharing. They may also be able to help support the patient as they describe the impact and the severity of the uncontrollable movements, because they're around the patient a lot more than I could ever be. A care partner could also record the patient's movements before the visit.
Tell me about your experience treating your patients with INGREZZA. What are some of the things you tell them?
I like INGREZZA because it was studied in a wide variety of patient types. It's one pill once daily and starts at an effective dose.
What is the most common side effect of INGREZZA?
The most common side effect of INGREZZA is sleepiness.
Will you share an INGREZZA success story with us?
Of course. One of the INGREZZA success stories that always comes to mind is a mom I have taken care of for years who has bipolar disorder. A handful of years ago, she had to be hospitalized. She had a relapse in her condition. When she came out of the hospital, Carnie, she and her daughter came to see me. And her daughter was really concerned and a little bit upset because all of a sudden her mom was chewing her lips. She had all of these movements in her jaw and tongue. Her daughter wanted to know, Dr. Mattingly, did my mom have a stroke when she was in the hospital? After taking a look, doing an exam, I recognized that she had moderate to severe TD of her lips and tongue, mild TD in her hands, and mild TD in the middle of her body. At that point, she was biting the inside of her jaw and leaving raw spots. She'd gotten to a point of wanting to isolate herself from people and activities she enjoyed due to the way the movements were impacting her. So I prescribed her INGREZZA. Fast forward 3 years, her daughter was getting married. My patient brought me a picture of the wedding. She goes, Dr. Mattingly, what do you see? And I said, God, your kids have all grown up. They have handsome boyfriends, girlfriends, and partners. What a beautiful setting. And she goes, no. What do you see? She said, I'm in the picture. And if I hadn't gotten help to reduce my TD movements, I wouldn't have felt confident enough to have had the photo taken. I wouldn't have this special moment with my kids captured on film.
Unbelievable. I love hearing that story so much. Opening up about embarrassing issues with a doctor or a clinician is really not easy. How can patients and doctors develop this trust?
I would say communication is key. Be open and honest with your healthcare provider. There is no stigma in talking to your healthcare provider about your symptoms. My wording for over 30 years is I'm going to listen to you and you're going to guide me. We're going to stick together till we get you better. I like to describe it as prescribing with hope. Put the patients at ease, break down the barriers of stigma, and make sure they know we are on this journey together. We have medicines that are very effective for helping TD for the majority of people.
Wow, this was amazing. Thank you so much, Dr. Mattingly, for this great conversation and information. I feel very informed about this, and I'm not even a patient. I think it is wonderful that you took the time out of your busy day to give us great advice and help put patients at ease for their next doctor's visit.
Important information. Approved uses. INGREZZA valbenazine capsules or INGREZZA sprinkle valbenazine capsules are prescription medicines used to treat adults with movements in the face, tongue, or other body parts that cannot be controlled, tardive dyskinesia, involuntary movements, chorea of Huntington's disease. INGREZZA or INGREZZA sprinkle do not cure the cause of involuntary movements and do not treat other symptoms of Huntington's disease, such as problems with thinking or emotions. It is not known if INGREZZA or INGREZZA sprinkle is safe and effective in children. Important safety information. INGREZZA or INGREZZA sprinkle can cause serious side effects in people with Huntington's disease, including depression, suicidal thoughts, or suicidal actions. Tell your healthcare provider before you start taking INGREZZA or INGREZZA sprinkle if you have Huntington's disease and are depressed, have untreated depression or depression that is not well controlled by medicine, or have suicidal thoughts. Pay close attention to any changes, especially sudden changes, in mood, behaviors, thoughts, or feelings. This is especially important when INGREZZA or INGREZZA sprinkle is started and when the dose is changed. Call your healthcare provider right away if you become depressed, have unusual changes in mood or behavior, or have thoughts of hurting yourself. Do not take INGREZZA or INGREZZA sprinkle if you are allergic to valbenazine or any of the ingredients in INGREZZA or INGREZZA sprinkle. INGREZZA or INGREZZA sprinkle can cause serious side effects, including allergic reactions. Allergic reactions, including an allergic reaction that causes sudden swelling called angioedema, can happen after taking the first dose or after many doses of INGREZZA or INGREZZA sprinkle. Signs and symptoms of allergic reactions and angioedema include trouble breathing or shortness of breath, swelling of your face, lips, eyelids, tongue, or throat, or other areas of your skin, trouble with swallowing, or rash, including raised, itchy red areas on your skin, hives. Swelling in the throat can be life-threatening and can lead to death. Stop taking INGREZZA or INGREZZA sprinkle and go to the nearest emergency room right away if you develop these signs and symptoms of allergic reactions and angioedema. Sleepiness and tiredness that could cause slow reaction times, somnolence, and sedation. Do not drive a car or operate dangerous machinery until you know how INGREZZA or INGREZZA sprinkle affects you. Drinking alcohol and taking other medicines may also cause sleepiness during treatment with INGREZZA or INGREZZA sprinkle. Heart rhythm problems, QT prolongation. INGREZZA or INGREZZA sprinkle may cause a heart rhythm problem known as QT prolongation. You have a higher chance of getting QT prolongation if you also take certain other medicines during treatment with INGREZZA or INGREZZA sprinkle. Tell your healthcare provider right away if you develop any signs or symptoms of QT prolongation, including fast, slow, or irregular heartbeat, heart palpitations, shortness of breath, dizziness or lightheadedness, or fainting or feeling like you are going to faint. Neuroleptic malignant syndrome, NMS. NMS is a serious condition that can lead to death. Call a healthcare provider right away or go to the nearest emergency room if you develop these symptoms and they do not have another obvious cause. High fever, stiff muscles, problems thinking, irregular pulse or blood pressure, increased sweating, or very fast or uneven heartbeat. Parkinson-like symptoms. Symptoms include body stiffness, drooling, trouble moving or walking, trouble keeping your balance, shaking, tremors, or falls. Before taking INGREZZA or INGREZZA sprinkle, tell your healthcare provider about all of your medical conditions, including if you have liver or heart problems, are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Make sure you tell all of your healthcare providers that you are taking INGREZZA or INGREZZA sprinkle. Taking INGREZZA or INGREZZA sprinkle with certain other medicines may cause serious side effects. Especially tell your healthcare provider if you take digoxin or take or have taken a monoamine oxidase inhibitor, MAOI medicine. You should not take INGREZZA or INGREZZA sprinkle if you are taking or have stopped taking a MAOI within the last 14 days. The most common side effects of INGREZZA or INGREZZA sprinkle in people with tardive dyskinesia are sleepiness and tiredness. The most common side effects of INGREZZA or INGREZZA sprinkle in people with chorea associated with Huntington's disease include sleepiness and tiredness, raised itchy red areas on your skin, hives, rash, and trouble getting to sleep or staying asleep. These are not all of the possible side effects of INGREZZA or INGREZZA Sprinkle. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Dosage forms and strengths. INGREZZA and INGREZZA Sprinkle are available in 40 mg, 60 mg, and 80 mg capsules. Please see full prescribing information, including boxed warning, at INGREZZATD.com and medication guide at INGREZZAMGTD.com.